Many thanks, Adrian. I would like to thank IWCLL for accepting our poster for presentation. So I would like to present the data for GALACTIC study, which is essentially a trial design primarily looking at patients who had chemo-immunotherapy in the past and had 2 to 3 lines of therapy. Sorry, I would work better now. So the initial trial design is as follows. The patients had, we had a planned cohort of 188 patients, and patient could have had 1 to 3 prior lines of therapy, which was primarily chemo-immunotherapy. The patients need to be in PR or CR with CRI, and their CLL count should be less than 5 into 10^9 per liter. They should have the chemo-immunotherapy just 3 to 24 months prior, and essentially this was our cohort, which was divided into 2 groups. One was an MRD negative cohort at the end of chemo-immunotherapy, which is our test group, and then the other group was the MRD positive patient, which was greater than 0.01%, and we recruited 29 patients into the MRD positive cohort, and then the MRD negative cohort, it was 19 patients. The trial was terminated early because of poor recruitment, primarily because of the introduction of new therapies. But now we just look at the data on the patients which we recruited into the MRD positive cohort. These patients were randomized into 2 groups. One group received consolidation with the Obinutuzumab, so kind of standard weekly dosing for first 4 weeks, and then it was 2 weekly dosing, and the other group did not receive any consolidation. The primary endpoint of the trial was undetectable MRD at 6 months post-randomization. And this is the primary endpoint result of the trial, and what we saw in the bone marrow, that at 6 months post-randomization, we saw that 10 out of 14 patients achieved MRD negativity in the bone marrow, whereas in the peripheral blood, we saw that 13 out of 14 patients achieved the IWCLL criteria for MRD negativity. And that translated into PFS improvement in the consolidation arm. So what you can see that the median progression-free survival in the patients who received consolidation with the Obinutuzumab is not reached, but the median PFS in the patients who did not receive any consolidation is 17.6 months. We have not seen any overall survival difference in this small cohort of patients. Now, if we look at the MRD negative comparison, so now I'm trying to look at the patients who became MRD negative after Obinutuzumab consolidation versus the patients who were MRD negative post-chemo-immunotherapy, which was our test group. We saw that there was no difference in PFS. So this suggests that our patients who achieved MRD negativity after Obinutuzumab consolidation, they were following the curve of the patients who achieved MRD negativity post-chemo-immunotherapy. And the overall survival difference was not different in the 2 groups. The time to become MRD positive was also looked at. There was some data which was missing in our cohorts, but 3 patients became MRD positive after they became MRD negative in the Obinutuzumab group. 11 out of 19 patients became MRD positive in the original MRD negative group. And there was no significant difference. The median time to become MRD positive in the pre-randomization group was 33.9 months, and in the post-treatment group, it was 21.5 months. So to conclude, 71% MRD positive patients achieved MRD negative bone marrow with Obinutuzumab consolidation. It was very well tolerated, and we did not see any major infusion-related reactions or toxicity. And it resulted in improvement in progression-free survival for MRD negative patients. PFS was statistically no different to patients who achieved MRD negativity post-chemoimmunotherapy. And I would like to thank you, all the patients and their families, to the NCRI CLL trial group, and all the other people who have helped us to conduct this trial. Thank you very much.